Now we'll move on to quickly cover Coxiella burnetii. This bacteria was originally classified within the rickettsial genus due to several similarities, but has recently been reclassified to be its own genus. Coxiella causes Q fever, so our drawing is going to be centered around Curly Q the ram. So let's start by drawing the barn with our ram in it. The first thing I'll point out is that the barn is red, which of course signifies that the bacteria is gram-negative. Now onto Curly Q, who is supposed to symbolize two things. First, we've made her pristine white without any markings or spots, and we did this to communicate that Coxiella does not cause a rash. This is a common source of confusion for students because Rickettsia, Borrelia, and Coxiella are all somewhat similar and can easily be confused. So right away we want to let you know that for testing purposes, Coxiella does not cause a rash. The second feature about our ram is the shape of her horns, which are exaggerated to look like curly Qs. And this association is to remind you that Coxiella causes Q fever. I mentioned that Coxiella was once classified as a rickettsial species, and part of the reason for this is that it too is an obligate intracellular organism. We've drawn this scene with the ram inside of a barn to communicate that the ram is inside, or intracellular, and we'll add this lock on the barn door to further illustrate that the ram can never leave the barn, and thus is obligated to stay indoors, just as Coxiella is obligate intracellular. Now, let's talk transmission. Coxiella forms a spore-like structure that makes it really sturdy, and these spores can survive the digestive tracts of animals and then exist in animal droppings and dirt. So to remember this, we'll use our recurring symbol for spores, the walnuts, and have bags and bags of them in the barn. We'll plop in some poop to remind you of animal droppings that contain these spores. So now we know Coxiella is contained in spore-like structures inside animal poop. But how does it get to infecting humans? Well, check this out. Curly Q is pretty pissed that she's locked in a barn, and she's really throwing a tantrum and kicking up a dust storm. This dust cloud is to help signify how Coxiella gets inside humans, via aerosol transmission. Farm animals are a major reservoir for Coxiella, which is why we have a farm-related story, and many outbreaks are related to aerosol transmission from farm animals to farmers. But another possible clinical scenario could be a veterinarian who helped deliver a baby farm animal and was exposed to placental excretions. That's pretty specific, but generally, if it's an outbreak, it's from aerosol transmission, and this dust cloud will remind you of that. I don't know about how the rest of the world works, but in middle of nowhere California, they stack huge piles of cow manure along the I-5 freeway, because that's clearly the logical place to put a lot of poop. And I swear you can almost taste the Coxiella as this manure wind rushes in through your car's air vents. If you ever visit California, I highly recommend it. That and surfing. Okay, on to clinical presentation. Now we'll draw in our farmer, who's coughing from all the dust that Curly Q's kicking up, and causing him to hit his head on the rafter. These are two symptoms of Q fever, pneumonia and headache. Also, he's stuck in the hot barn, which is causing him to sweat profusely, and this represents that he's feverish. So far, these symptoms of cough, headache, and fever are pretty much just like any other pneumonia, but there is one last symptom that really makes Q fever stand out from the crowd. This is that it also causes hepatitis. So to symbolize this, we'll draw on this cow in the back of the barn. Not only are cattle another source of the infection, but we've drawn the spots on the cow to resemble a liver, to remind you of this hepatitis. This is just like our brucella video, so if you ever see a test question that has hepatitis and pneumonia symptoms, in the context of being around animals, think Coxiella and possibly brucella. But for brucella, they'll really emphasize the classic undulating fever, so really you shouldn't confuse the two. For treatment, usually no antibiotics are needed. The infection is self-limiting and goes away within 2 weeks. Very rarely, a patient with chronic Q fever can develop endocarditis, especially if they're immunocompromised or have previous valvular damage. But this is hardly ever seen on exams. As for prevention, pasteurizing milk will kill most organisms, and vets can receive an acellular vaccine since they're at high risk. However, these 2 points aren't very high yield and are probably only important if you want to drop out of med school to become a vet or a farmer. Well, that wraps up Coxiella and Q fever.